Hi, this is Giuseppe Argenziano from Naples, Italy, and today I would like to share with you a couple of cases in differential diagnosis. So we are speaking about lesions on the scalp, especially of elderly people. When you have a lesion like this in front of you, newly developing on the scalp of an elderly patient, especially a man. Of course, there are a few malignancies that should come to our mind, that should be included in our differential diagnosis. Of course, one possibility could be basal cell carcinoma, which is the most frequent type of malignancy of the skin. The second option in order of frequency is squamous cell carcinoma, and this cannot be excluded in this case because of the peculiar clinical morphology. Of course, we can also consider a third possibility, which is amelanotic melanoma, but we should not forget also to include in our differential diagnosis a fourth but less common type of malignancy of the skin, which is Merkel cell carcinoma. So these four types of malignancies should be included in our differential diagnosis. In this particular case, this was a squamous cell carcinoma, and the lesion was treated surgically. The second case that I wanted to present to you today, we have a kind of similar situation. We have again lesions located on the scalp of an elderly man. Definitely there is some damaged skin. Definitely there are actinic keratosis, multiple, and especially at the bottom side of this picture, so in the more frontal area of this patient, we have multiple, a kind of big nodule which is looks ulcerated. Particularly, this nodule was biopsied. Of course, again, we thought first basal cell carcinoma, second possibility squamous cell carcinoma, and so on. But as a surprise, the histology revealed only a kind of unspecific inflammatory infiltrate. So no malignancy, no skin neoplastic cells were seen in this histopathologic specimen. So what could be the final diagnosis here? Well, the final diagnosis here can be only interpreted as the so-called erosive pustulosis of the scalp. This is a not well recognized entity, which, by the way, we are starting to see more and more in our clinical routine. This is a disease of an inflammatory condition of unknown etiology, in which you have a kind of the elementary lesion is a pustule, but basically you see these kind of erosive lesions in some way what's widespreading on the scalp, especially of elderly people, and that's why some may argue that a possible pathogenesis, pathogenetic mechanism could be sun-induced dermatosis. By the way, it's a matter of fact that this kind of disease can be easily treated with a short-term of topical steroid application. In this particular case, after 7 days, the lesions were completely gone, and of course, then we started to treat the field cancerization. So basically, we used PDT, photodynamic therapy, to remove the remaining actinic keratosis. So that's it for today, and I thank you for your attention. Bye-bye.